Okay, so now we're going to cover Chapter 6, the Integumentary System and Body Membranes. So, the integumentary system and body membranes. Some different classifications of different body membranes. First, there's the epithelial membrane. So this is composed of epithelial tissue and the underlying layers of connective tissue. I won't get into too much detail. I really don't expect you guys to know a whole lot about like different types of epithelial cells. This is just so that you kind of have a broader knowledge so that you understand a little bit more about explanations and like before Chapter 5 we were talking about epithelial cancers. If you don't really know what epithelial tissue is, you're just not going to have a good understanding of what an epithelial cancer is. So this will just help give you a little bit better understanding. But like I said, I don't expect you guys to remember a ton of detail about it for like a future exam. So there's epithelial membranes and there's connective tissue membranes. Connective tissue membranes are those that are composed exclusively of various types of connective tissue, of which there are quite a lot of. So you can see here, this is just a picture to show you guys what the tissue membranes are, kind of. So we have skin, which is on the outside. And people sometimes think that membranes end right there, when really there are a whole lot of membranes inside the body. There's a membrane everywhere. So you have these mucous membranes up in your mouth, and you have some serous membranes in your lungs and in your GI tract. Then you have your parietal and visceral layers. They're just all of these membrane layers everywhere throughout your whole body. So for epithelial membranes, you have your cutaneous membrane, which is your skin, and then there are various serous membranes. Serous membranes are kind of like how the name sounds. They're very serous and fluid. There's normally some like fluid liquid kind of involved in keeping them moist and pliable. So there's like the parietal membranes, which line walls of body cavities, and then visceral ones, which are ones that cover some organs inside those body cavities. And those are kind of important to know because you'll see those terms a lot in the medical world. So for some examples, you have your pleura. So parietal and visceral layers that line the walls of your thoracic cavity and cover your lungs. So those are kind of important to know. And there's ones like your peritoneum. Your peritoneum, your parietal and visceral layers. Remember, parietal is kind of lining the cavity and visceral is lining the organ. And those are the ones in your abdominal cavity. So they cover those organs. And one of the things that's really important about this is they help protect it, but they also kind of help hold everything in place and keep it moving and lubricated and functioning the way that it's supposed to. So you can actually have diseases of these specific membranes. You can have a pleurisy, which is when there's an inflammation of that serous membrane that lines the chest cavity and covers your lungs. Kind of makes sense since it's based off of the name there. Or you can have a peritonitis, remember, because it was your peritoneum. And that's an inflammation of those serous membranes in your abdominal cavity. And I'll give you guys a heads up now. Normally, anytime it's a disease or a disorder or anything like that, chances are I'm going to ask you a question about it on some future quiz or exam. So any of these things, just anytime you ever see it in one of the lectures or PowerPoints, chances are you're going to get asked a question about it somewhere. So besides just those serous membranes, you also have mucous membranes. Mucous membranes are the ones that line the surfaces of the body that open out to the exterior. So that's like your nose and your mouth and your esophagus, ones that are getting that direct exterior content. And they produce a really thick mucus, hence the name, and that really thick secretion helps to keep those membranes in those areas that are exposed to air a lot softer and more pliable, and they just help protect it a lot more from that external environment. So those are some of our more epithelial membranes. So now we'll do some connective tissue membranes. So connective tissue membranes are ones that do not contain epithelial components. And they use a lubricant that's very specific. It's called synovial fluid. So your synovial, like an example, your synovial membranes are the ones in the spaces between joints and the lining of some bursa sacs. So you have synovial fluid and those synovial membranes on all of your joints, and that's what keeps them well lubricated and moving. If not, it would be like grinding bone on bone, which really isn't very pleasant, and that's actually kind of what arthritis is. So for your skin, just now that we have a little bit of the basic background information down. Your skin is composed of two layers. You have your epidermis and your dermis. Your epidermis is the outermost layer. It's much, much thinner, and it's kind of the layer that we see in the outside world, and it's composed of kind of a whole lot of layers of epithelial tissue. So you can see here, this very, very teeny little outer layer, that is your epidermis. And this great big one here that kind of contains a whole lot of accessory organs, that is your dermis. So that's what they mean when they say that your epidermis is really just that nice thin outer layer. Your dermis is really the one that kind of packs the punch. So your epidermis, or your epidermis, the innermost or deeper layers of the cells continuously reproduce. So they kind of keep forming those new cells to get closer and closer to the surface, and that's because your outer cells kind of continuously just flake off. So that's why you're kind of constantly shedding skin cells, and to regenerate that, to replace it, your like very bottommost layer of your epidermis keeps making new ones to sort of keep pushing the older ones up towards the surface so that they can eventually flake off. Sometimes that little bottom layer is also called your pigment layer, and that's because it contains melanocytes, and the melanocytes are the ones that produce the brown pigment melanin that kind of gives your skin its color. So that's where those are located. And then as these cells approach the surface, they're actually filled with this very tough and waterproof protein named keratin. And that's kind of what makes them stiff and eventually makes them flake off as well. So your outermost layer are really full of keratin. And that's what makes your skin so tough and waterproof and makes your skin work so well at protecting your body. So your skin, like we talked about how there's melanin in it, and that's kind of what gives it its brown color, but your skin can also have a couple of other colors. It changes pretty easily. So it can have a pink flush to it, and that's because in your dermis, there are a lot of blood vessels, and if they get dilated for some reason to increase the blood flow, it'll actually shine through your epidermis and give your skin like a pink or a red color to it. Now, it can also go the other way. You can have a cyanotic look, so cyanosis. Cyanosis is more of a like bluishy gray color, and that indicates a decreased blood oxygen level. So that's when you're not getting enough oxygen to those tissues. It's too decreased. That makes it kind of a bluish gray color, which is cyanosis. And then you can also have vitiligo. And that's a patchy light skin area, which is when you've lost some of the epidermal melanocytes. So they're little spots where you just don't have that same brown pigment. It's the little light areas. People can also have increased skin pigmentation, and that can be caused some by normal hormonal changes, like a lot happens in pregnant women. They get some increased skin pigmentation in certain areas, especially on their face sometimes. And then you can have freckles. Freckles are just little small flat macules. They're very common skin pigmentation. It's just little areas of an increased skin pigmentation on somebody. So, then, like we said in the first, or before we started some of this description of the epidermis, that you have the epidermis and then the dermis. So your epidermis and your dermis have a little junction area, and it's a special area of connection between the two layers. Sometimes it's described as having spot welds, and that's because the dermis provides support for your epidermis, and anything that causes a weakened or destroyed junction there is actually what causes a blister. And that's why your blister seems closed. It's because your epidermis on the outside is still totally intact, but you've damaged where it holds on to your dermis. So it creates that little blister, that little kind of pocket of fluid in between those two layers. So now we've talked about your epidermis, let's talk about your dermis. So your dermis is a deeper and much thicker layer out of the two layers of the skin. It's composed largely of connective tissue. So the upper area of your dermis is characterized by these parallel rows of dermal papillae. And they're little peg-like things. So thick skin has those little friction ridges and no hair. It's like on your palms or on your soles of your feet. And then the thin skin has more irregular, shallow grooves, and it grows hair there. Deeper areas of your dermis are actually filled with these networks of this very tough, like collagen, stretchable, elastic fibers. And that's what makes your skin so stretchable. That's why you can really change shape and bend and move a lot, and your skin just kind of always seems to stretch and form. It's because of that, all those elastic collagen fibers. So these are pictures of the two different types of skin, like we said on those thicker areas, like on the soles of your feet or the palms of your hand. Everything's kind of arranged in order, and it creates those thick ridges. And then in other areas where your skin's a lot thinner, if you see it's not kind of creating those just thick set ridges, you can sort of see there are lines kind of almost creating little shapes there, and grows some fine hairs. So those are kind of two different types, and those are your dermal layers and how that's being produced. Affects kind of the outward appearance. So then, like we said, that they have a lot of elastic fibers in there, and that's what makes your skin so stretchable. Those elastic fibers, just like with most things, decrease as you age, and that's what really contributes to a lot of the wrinkle formation. So the older you get, the less elastic all of those fibers are, and the more likely you are to form wrinkles, because now you stretch it, but it's not going to go back quite right to that nice smooth surface at the end of it. Another thing that can happen is that if you stretch your skin too far too fast, you actually develop striae or stretch marks. And those are kind of those elongated marks. I'm sure everybody is well aware of what they look like. And that's just that you've kind of stretched your skin a little too far, a little too fast, so it couldn't actually make enough new cells to cover the whole area. So it kind of like altered the ones that were there just to sort of make it fit. So your dermis, besides just containing all those connective tissue cells, also contains a lot of other stuff. So it contains a lot of nerve endings and muscle fibers and hair follicles and sweat and sebaceous, which are oil glands, and blood vessels. So your dermis is, like I said, it's kind of the bulk part of your skin, and it contains all those accessory things that help with the function. So you can also have a couple of interesting things that go on with your skin, like birthmarks. Birthmarks are just a malformation of the blood vessels in that dermal layer. So it's just getting a little bit more like increased blood flow a little closer to the surface. So it creates those red spots. Some of the popular ones that you especially see on kids are things like port wine stains and stork bites. And those are just the ones that you see infants born with, the little red spots that they get born with. So skin has a lot of appendages. So skin itself is really just exactly what it said. It's skin. That's your integumentary system. But it has all these appendages that are involved with it. And those are things like hair. Hair isn't really necessarily part of your skin. It's just this separate appendage that's very involved with your skin. So, newborns have something on them called lanugo, which is very soft, fine hair, and that's like all over their body. On an older adult, hair growth requires this little like tube-like structure in your epidermal and dermal layer. It's called your hair follicle, and hair begins from your hair papilla, which starts down in your dermis and kind of grows up and out through your epidermal layer. Your hair root lies in the follicle, and the only part that you normally see is the shaft. Then you have an erector papilla muscle, which is actually a specialized smooth muscle that is what gives you goosebumps, and it causes the hair to stand up straight, and that's because it's trying to trap air next to your skin so that it helps keep you a little warmer. And then another interesting thing to know about hair is that alopecia is hair loss. So that's what happens, like we said earlier, if someone's having chemo or something, they have alopecia, they have hair loss. So that's a picture of, right there, some alopecia. Someone has a little bald spot there. So, besides just hair, you also have a lot of receptors in your skin. Think about how sensitive your skin is and all of the things that it picks up and feels and tells you messages about. So you have all these very specialized nerve endings in your skin, which makes your skin really act like a sense organ. So you have all these different corpuscles in your skin that are sensing all kinds of stuff. I don't expect you to know exactly all the different names. I just want you to know what it detects. So your skin's going to detect light touch and pressure and temperature and pain, heat, that kind of stuff. So besides just those nerve endings in your hair, you also have your fingernails, which everyone I'm sure is very common or very familiar with. And those are produced by or the epidermal cells that cover the terminal ends of your fingers and toes, and they're really there because they're very protective, very hard and sturdy. The part that you see is called the nail body. You actually have a nail root that lies kind of in that groove underneath. It's kind of hidden by your cuticle. And then if you look at your fingernails, you kind of have a little light crescent shape right at the base of it, and that's called your lunella. So your nail bed can actually change color with your blood flow. If you have very poor circulation, it can be very pale. If you're not getting enough oxygen, it can actually become kind of a bluish, dusky color. Or they can actually turn much more pink when you're getting a lot of good, well-oxygenated circulation there. So you can see the picture. You can see the nail body is what we see, the lunella, little crescent shape, and then your nail root is down here underneath your cuticle in between some layers of skin. So can have some normal variations in skin structure. So you can have the longitudinal ridges, which are very common in lighter skinned individual, or you can have pigmented bands if you're darker skinned. It's kind of the same normal variation. It's just because dark skinned people have more pigment in their skin, so their nails kind of pick up some of that pigment. Where if you have very fair skin, you're just more likely to get ridges, but they're not pigmented. Then you can also have some abnormal variations in your nail structure. So onycholysis is one of those abnormal variations, and that's the separation of the nail from the actual nail bed. Or you can also have pitting of the nails, which is very common with psoriasis. So you can see some examples here. These are the longitudinal ridges that often happen with lighter skinned people. As you can see here, these ones are darker and more pigmented. And that's just because there's more pigment in these epithelial cells than there are in these ones. And here you can see all those light areas are actually where the nail is starting to peel away from the nail bed. Oftentimes that can actually be caused by a fungal infection or an injury can do that as well. This one where it's happening in a lot of the fingers is probably some sort of infectious process. And then down here, this is pitting of the nails, and that's common with psoriasis. So, besides those, we have another type of appendage, and that would be your skin glands. So, your skin itself isn't secreting anything. It's the glands that are secreting things. And you have two different types of glands, or two main types. You have sweat glands and sebaceous glands. Your sebaceous glands are your oil glands. So your sweat glands, you have two different kinds. There's your eccrine sweat glands, and these are your most numerous and widespread sweat glands. They produce just normal, thin sweat, and they're kind of all over your skin. And they function throughout your entire life to assist in controlling your body temperature. When you're hot, you sweat to produce kind of that liquid on your surface so that it will evaporate and help to cool you off. You also have apocrine sweat glands, and these are the ones that are found in your axilla and in your genital area, and they produce a much thicker, almost like milky kind of secretion sweat, which is very different from eccrine perspiration. And the breakdown of this secretion by the skin bacteria that you normally have actually creates an odor. So that's why those areas of the body produce a particular smell when you sweat from there. So then, like I said before, besides your sweat glands, you have your sebaceous glands. Your sebaceous glands secrete oil or sebum, and it's for your hair and skin to help keep them like soft and flexible so that they don't get dried out and cracked and very brittle. So the secretion normally increases during adolescence, hence normally the oily skin acne development that happens with adolescence. And that's because the amount of it that's secreted is actually regulated by your sex hormones. So when they start kicking into gear is when your skin starts getting really oily. So the sebum in your sebaceous gland ducts can actually darken and form blackheads, and that has to do with oxidation and that kind of stuff, so we won't really get into that. And then something else that can happen is you can have acne vulgaris, which is a type of inflammation of your sebaceous gland ducts, and that's what causes most acne cases. So you can see here the acne, so that would be an acne vulgaris right there. So some functions of your skin. So your skin is super, super important. It's kind of one of the organs in the body that gets dismissed a lot because we don't think of it as being as important as it truly is. But really it does a ton for us as humans. So you're safe against infection from microbes, kind of like we talked about before with the opportunistic ones. So your skin's helping to protect you from those microbes invading and harming your skin. It's also going to protect you from the ultraviolet rays from the sun, which are very burning and damaging to your body. Protects against harmful chemicals that are in the environment. Protects against cuts and trauma, because you know, a little cut on your skin, not that harmful, but if I did a little cut on my liver, a lot more damaging. And another thing that happens is that with bruising that you see a lot on your skin, it's a discoloration. It's actually from damaged blood vessels underneath your skin because that blood's released. But your skin's really helping to protect and kind of hold it all in. So, I mean, if you didn't have your skin when those blood vessels broke, which we just see as bruising, you'd actually be bleeding everywhere if your skin wasn't intact and there to help hold it all together. Now, if you have damages to your skin, one thing that we can do is we actually do skin grafts, which replace skin that's damaged by disease or destroyed by trauma. Because of that long list of things above here, with all that important stuff that your skin's going to do. So if you didn't have intact skin, you would be very, very exposed to a lot of dangerous things in the environment. And that is a very gross picture of a skin graft. So what they do with skin grafts, you can skip this slide I guess if this utterly disgusts you, is that they're actually stretching the skin over somebody's hand. This is probably a burn victim. And they cut all these little perfed holes when they take the graft to actually stretch it over a larger area. Because this is actually just a little tiny graft. And they've stretched it so that it covers a lot more space and then stapled it in place to help it heal. So, back to more of the functions of the skin. So, the skin works a lot to help regulate your body temperature. Your skin can actually release almost 3,000 calories of body heat a day. It's working overtime to try to regulate your temperature. Like we said before with the homeostasis, your skin's working to maintain that temperature homeostasis in your environment. So some mechanisms of temperature regulation, besides being a receptor of temperature, it's also going to regulate with sweat secretion. So if you're too hot, it's going to release sweat to your skin's surface so that it can evaporate. Or it will alter the blood flow to your skin surface. And that's because if the environment's cold and you're starting to drop in temperature, it'll constrict all those blood vessels that are flowing through your dermal layer to try to hold blood closer to your body and keep you warmer. Where if you're really hot, it dilates them out towards the surface to try to expose them to the outside air, which is cooler than your body, so that they'll cool off and you'll kind of circulate a little bit cooler blood back to your body. And that's, like we said before, because the skin's functioning as a sense organ. It's kind of sensing the environment around you because of all those receptors that are in your skin surface. So, like we said before, it says touch and pressure. It's also going to sense pain, heat, and I don't know why I have color in there other than it does change color based on some of these things. So those are just the receptor parts of your skin. So another thing that's pretty important for you guys to be aware of are some disorders of the skin, like skin lesions. Skin lesions are any measurable variation from the normal skin structure. So you can have elevated lesions, which are ones that kind of cast a shadow around the outside of their edges. Some examples of this are what's listed below here. Like you can have a papule, plaque, vesicle, pustule, crust, or a wheal, which are hives. We'll expect you to know what all of those are and be able to tell the difference. So just kind of want you to know a little bit about their skin lesions, and they can be elevated, or they can actually be indented, or they can be flat. Like a flat one would be a macule, which is like a freckle, or you can have a depressed lesion, and that would be something like an excoriation, which is when your epidermal layer is missing, something like a scratch, or an ulcer, which is more crater-like, or a fissure, which is actually a deep crack or like a break in the tissue. So some lesions are just produced by scrapes and cuts, and they easily repair themselves. Some of them take a little bit more time and some effort to help them in their healing process. So this is just a picture of skin as it's healing. So this is someone who has maybe a fissure in their skin. It's that deep crack. So this would be their epidermal layer, this darker purple one. And you see their dermal layer here, and then this is adipose tissue underneath. I know we haven't covered that yet really, but adipose tissue it's like fat cells underneath your skin. So they have a blood clot in the area, right? And then what happens is you have some fibroblasts, which are your kind of connective tissue building cells. They're coming in here and they're actually trying to build all new skin cells up in here. And then finally you have a new scar tissue forming here. So that's freshly healed. And you notice there that when there's scar tissue, it does heal just a little bit differently. It's not totally normal, but it is now intact and protective skin again. So one of the really dangerous things that happens to people's skin is burns. The treatment and recovery or survival of the burns really depends on how much of the skin area was involved and the severity and depth of them. There are a few different ways that we classify burns, or different classification levels. So you could have a first-degree burn, and that's a partial thickness burn. That's one that burns only the layers of the epidermis. So that's like your typical sunburn. It's a first-degree burn. You did burn your skin, but it was really just the epidermis that was affected. Then you can also have a second-degree burn. So that's a partial thickness burn, but involves the deep layers of your epidermis, and can actually, because of that, it damages the upper layers of your dermis as well. Then you can have a third-degree burn, which is a full thickness burn, and that's because it has completely destroyed your dermis and your epidermis. It can start to involve some of your underlying tissues as well, and we refer to those as fourth-degree burns. So if I burn my hand and it not only goes through my epidermis and my dermis, but it also burns some of the muscle tissue underneath, that will be a fourth-degree burn. And this creates some lesions, which are actually insensitive to pain because it's actually completely burned off and destroyed the nerve endings that are immediately after the injury. But then normally intense pain is experienced after that, because the nerve endings are still there. Like that initial burn just like burns off the nerve endings so that it doesn't feel anything. So this is kind of a picture with some of the deeper layers so that you can see. So once again, you have your epidermis, which is here on the outside. This is your dermal layer right here, and you can see how you have some glands and hair follicles, blood vessels, and then this is, like I said before, your adipose tissue, which is a fat layer underneath your skin, and that's really used a lot for cushioning the muscle and bone. So it's just kind of giving you an idea of what all the layers are. And so then you can see here, so 1st degree burn, that is just this epidermis layer. 2nd degree burn is starting to get into your dermal layer. A 3rd degree burn goes all the way down, and it's actually going to affect that adipose tissue because the adipose tissue is at the bottom of your dermis. And then a 4th degree burn goes all the way down to whatever structures happen to be below your adipose tissue. And those are some pictures. So that top one looks like that's probably the epidermis and the dermis. It's probably a 2nd degree burn because it looks like the dermis is also burned as well, but we don't really see any underlying structures. And then this one would be a 4th degree burn. You can see it's very charred and looks like it's actually damaged away some of the stuff that's underneath those tissues. It's a little hard to tell specifically, but that's a pretty severe burn. So another very important thing about burns is being able to estimate the body's surface area. And that's because it's going to tell us how severe the burn is and what the chances of survival and what we need to do for the person's recovery is. And for estimating the body surface area used in burns, we actually use what's called the rule of nines. So for the rule of nines, we divide the body into 11 different areas of 9% each. And then we add on an extra percent of body surface area that's for the genital area. So that's 1% to finish up and round it out to the complete 100%. So here's a picture. So your head total will be 9%. And then the front of your arm and back of your arm, so one whole arm is 9%. Genitals, remember, are 1. The front of your leg is 9%, the back of your leg is 9%, and then your trunk's a little bit different because that's 18. So you sort of have it like if you divided it in half, each half would be 9 for both front and back. But that just helps give you a better estimate and you can figure out how much body surface area on a person you think is burned. So that's what the rule of nines is. So to move on from burns, we have some skin infections that we're just going to cover here. So a pretty common one is impetigo. Impetigo is a very highly contagious staph or strep infection of the skin. Tinea is a fungal infection of the skin. There are a few different forms that can occur. Warts, those are very benign neoplasms. So if you remember, neoplasms are actually tumor cells, and that's because they're creating that tissue that's not growing, or those cells that aren't growing normally and they're growing too fast. So it kind of creates that like bulgy cluster of cells, which is really kind of what a wart is when you think about it. But warts are actually caused by a virus. Remember how we mentioned that before when we were talking about tumors, or that one of the things that can cause tumors are viruses. So the papillomavirus is actually the one that causes warts. And then we can have boils. Boils are a staph infection in hair follicles, or scabies. Scabies are a parasitic infection. So those are a couple of pictures. So this one here is a baby that has an impetigo infection. And this one's a tinea infection, which is commonly referred to as a ringworm, and that's because it gets that round look to it. Really, it's a fungal infection. So this is a boil. Remember, we said a boil is one that's an infection, a staph infection, in a hair follicle. So you can see that there's hair growing out of here. And then scabies, just that little kind of scratchy thing looking there is actually scabies because it's a parasite. So a couple of other really important things to know about. One of them is decubitus ulcers, or bed sores, or pressure ulcers. And those actually happen when the pressure to a specific area actually slows down the blood flow to that localized area of the skin. So it's kind of like like if you were to sit on your chair right now watching this lecture and you didn't move for hours and hours and hours, and I mean by didn't move, like didn't shift your weight, didn't do anything, you just sat there, what would happen is where your bony prominences are pushing your skin between whatever the bony prominence is and the hard surface underneath is actually squeezing the blood vessels. So in that particular area, maybe blood is flowing through some of the thicker, bigger blood vessels, but through like those thin little capillaries that are circulating your skin, blood just can't get there. So you're literally starving those tissues. You're cutting off their nutrition supply and you're cutting off their oxygen supply. So you're starving them to death, which is kind of what eventually leads to pressure sores. If someone's really not moving at all, they can get breakdown areas because we're starving them with blood and nutrients. Those are a very big issue, especially in hospitals. It's normally talked about a lot. It's a really big issue in people who are very sick and very immobile, and that's because normally those are people who, as a baseline, aren't getting a whole lot of oxygen or aren't getting great nutrition just as their baseline, as their normal function, because of how sick they are. So now on top of that, they're not really moving either. So they're not having enough nutrition to circulate in the first place. And now on top of that, we're going to decrease the blood flow. So that puts them at very high risk for decubitus ulcers. Another thing that people can get in their skin are hives. And hives are these red lesions that are caused by a fluid loss from blood vessels. Hives are normally associated with an allergic reaction to something, and that's because you're having a vascular response to that allergic reaction. So it's actually altering the blood flow. So it's causing that fluid loss is leaking out of your capillaries or out of your blood vessels and creating those like red lesions on your skin. And then you can have scleroderma. Scleroderma is when there's a disorder of the blood vessels and connective tissue by hardening of the skin. And there are a couple types. It can be localized or it can be systemic. There we go. Sorry for the little glitch in my slides, apparently. So like we said, that it can be localized or systemic, and it's a disorder of the blood vessels. So basically they become really hard, which means that they're not really going to alter and dilate or constrict based on the body's needs. So it tends to create kind of reddened or light-colored patches on the skin. And it can either be localized, which means it's only in one little specific area, or it can be more systemic, which means it's covering larger portions of their body. But it can be pretty damaging because it's not allowing them to circulate their skin the way that they really should. People can also have psoriasis. Psoriasis is a chronic inflammatory condition of your skin, which is normally accompanied by a lot of scaly kind of white plaques on the skin, and that's because your body is sort of having an autoimmune response. It's like attacking itself on your skin. It's creating these like scaly plaques as a result of that. You can also have eczema. Eczema is another type of chronic inflammatory condition of your skin, and that's normally you see these papules or vesicles or crusts. And oftentimes it comes as not just a disease in itself, but as a symptom of something else, where you have an underlying condition that's kind of like making this eczema happen. Some people do have it as just like a kind of a chronic condition for them, or they'll get flares when something else is going on in their life. So those are some pictures. You can see here that would be a decubitus ulcer right there. So that's someone that has had a lot of pressure on that heel. And so it's actually kind of cut off the blood supply to, it looks like their dermal or epidermis, probably a little bit of their dermis. So you can see the structures that are underneath there because it's actually killed off that tissue. And then hives, you can see these raised areas because that's where the fluid's leaked out of the blood vessel. Psoriasis causes those scaly patches. Remember that was an autoimmune disease, kind of causing the body to attack itself and create those. And that's actually contact dermatitis, which is a little bit different. It's like a reaction to something. So now to just kind of briefly touch on skin cancer. So skin cancer, there are a few different types, and that's because they're just different types of skin cells. Won't really get too much into it other than melanoma is the really common one. And that's when there's a malignancy and a mole on the skin, and that's the most serious type. It's also the one that we hear talked about the most. The other thing that's normally useful to know is that just the carcinoma, remember that term we talked about before, and that was a type of cancer. We talked about it last chapter when we were doing mechanisms of diseases. So that's when there's a malignant cancer of the epithelial cells. So the most important causative factor for most types of skin cancer is actually exposure to sunlight. So if you remember back a few slides ago, we said that's one of the things that your skin actually is protecting your body from. It's protecting your body from those ultraviolet lights because they're super damaging to your skin. And your skin's protecting you, but eventually if it gets exposed to too much stuff, your skin's actually going to be damaged and start developing skin cancer. So it's protected the structures underneath, but it can't protect itself and the structures underneath, so you can eventually get skin cancer from it. And then the other one that's mentioned here is Kaposi sarcoma, and that's characterized by these purple lesions, and it's really normally associated with people who have an immune deficiency. So that's something like AIDS, where their immune system is severely diminished, and so they can't really protect themselves anymore. One of the characteristics that they can get is they can get this Kaposi sarcoma. And then those are some pictures. You can see the different types of carcinoma. There's the melanoma, that's normally characterized by the dark mole with kind of those irregular edges. And then the Kaposi one, you can see it's kind of those purplish lesions there. And that brings us to the end of our integumentary system.